So, as you can see, I made it. Today marks 2 weeks post surgery. It's been a roller coaster, but I feel great. I have little to no pain, just some discomfort, and yeah, let me tell you about the last couple weeks. So, basically, we went in Wednesday, November 20th. Went in for the aortic catheterization. They were actually able to do it through my arm, which was a really cool thing, as opposed to going through the groin. I guess it saves on a lot of pain afterwards. But I think an easier way of going about it, and less chance of complications or whatnot. So yeah, we went in Wednesday morning early, kissed the kids off, and we got to the hospital around, I guess it was around 7:30 a.m. They took me pretty much right in, went into a room, and the nurse basically said, it was actually a room with a lot of curtains and everything. Nurse said, go ahead, get undressed, put a gown on. I started to undress. I guess she was trying to ease me up a little bit. She said, don't worry, everybody gets naked here. It's not a problem. You got to take everything off. And I turned to her with a straight face. I said, you're not naked. But, which got a good laugh and helped to lighten the mood, which I needed. But yeah, they kind of just kept it going quick. There was not a lot of downtime. They took me into the room, slightly intimidating room, but not too bad. The only intimidating thing was really the wire. It was like 3 feet long that was going into my arm, up around my shoulder, down, and I guess into my heart, so they could see all the blood vessels or whatnot. Went very smooth. They gave me some relaxation medicine, which helped, and yeah, it was less than an hour. It might have been about a half hour. The procedure wasn't bad at all. They pretty much put me in a state where I was aware. I was just kind of drowsy. But in and out, no problem. Went right from there. My room was ready. Went right into my room. That was Wednesday afternoon now. And basically just hung out with my wife. We had some talks. Like I said, the 2 weeks, and especially the last week prior to everything, was extremely difficult, consuming me mentally, and I did, like I said in the last post, it was just getting to the point where I just needed to get it done. So that night was tough sleeping, but anyway, got up early in the morning. They washed me with the night before, actually at midnight. I had to stay up till midnight. I had to take a shower with special soap. The next morning, the nurse came in and had to rub these towelettes over me, basically another form of sterilization. Highly, highly, highly recommend shaving your entire upper body, from the waist up. It's going to help tremendously. The amount of things that get stuck into the tape. I'll see if I can post it on here, but I basically, jumping around a little bit, but I had three needles in this arm, 3 in this arm. I had wound up with 4 wires in my stomach that went up to my heart in case they had to jolt the heart or whatever. 2 drain tubes, various sticky things all around my body for constant heart monitoring. 3 stents in the neck, not pleasant. But regardless, my point is they were constantly looking for veins and all around the chest. I mean, they shave this area anyway, but really good idea, shave your entire body. It's going to help tremendously. Promise you. Huge. Some of this tape they use is like glue, and when they rip it off, it's still painful without hair. I can't imagine with hair. Little tip. But anyway, it was now it's Thursday morning, and at about 11:30, they came in and told me they were going to take me within an hour. Prior to that, they said around 12:30, between 12 and 2. So 11:30, they came in. They did say we're going to take you in about an hour. So again, things began to get pretty real. And it was about 4 minutes later, right after they said that, that a stretcher came to my room and said, okay, we're ready. The operating room's ready. We're here to take you now. So probably better that we had 4 minutes instead of an hour to think about it. But things got pretty real. I actually had to take off my wedding ring. They wanted all jewelry off. I had to take off my wedding ring, and which was I had to give it to my wife. But it was the first time I had taken it off since I got married. So that was a moment for my wife and I. 15 years, 1 month, 27 days, and had to take it off, but all part of it. So got on the stretcher. My wife was not allowed to come down to the operating room with me. We wheeled away. She was next to me. Very emotional time. I imagine it's one of the times that saying see you later to the kids and that moment were the two moments that I thought about often. And it was emotional. It was tough. Thank goodness for meditation and a lot of prep beforehand, which I highly recommend. But yeah, it was a tough ride. Basically got wheeled into the elevator. My wife was on the other side of the doors. I was inside on the stretcher, and we had that moment. It was a moment where, the doors closed, and it was tough. I know on the other end, she broke down a little bit, and it was tough on her. But on my side, it was extremely difficult. But I got through it. I just kept trying to clear my mind and focus on breathing and all my positives in life. Got down, got in front of the door to the operating room. They then proceeded to, the two anesthesiologists came over. They started to ask me some questions. Little strange moment at that point, not panicked, but the big decision in this whole matter is, are you going to choose mechanical or are you going to choose tissue? Two very different valves. And I had told the surgeon, I missed a part, the surgeon did come by on Wednesday evening. He came by to speak to me, and I told him in passing there that, I wanted to do the tissue valve and everything, but nothing was ever written down. Nothing was ever signed off on. It was kind of vague. He asked me, and I said, I'm going to do tissue. As you know, if you're watching this video, it is a very major decision whether you do mechanical or tissue. It's something that you have to, it's extremely important, life-changing. You have to look into the two options. Basically, like I said previously, the mechanical, you have to be on blood thinners the rest of your life. It's probably a one-time surgery. Now, so often they're not as sure of that, but tissue is basically much stronger. You don't have to be any on coagulants the rest of your life. It's for many reasons, it's the way I chose. But anyway, so they were speaking to me about that, and I brought that up, and they're like, oh, well, the doctor, he knows what to do and everything. I'm like, well, you sure? It was like I said, it was a vague time, and they just assured me that the doctor would know which valve to put in, and he's got it under control, not to worry. And sure enough, they were right. So I also took part in a clinical trial where my surgeon, Dr. Leonard Girardi, was heading, and it's basically for drainage reasons. He spoke to me about this that Wednesday evening also. Basically what it is, they put in drain tubes or whatnot, but it's what they additionally do is you still have the sac around your heart still does fill up with fluid. So what they do in this clinical trial is they actually put a small, if you so sign up for it, which I did, they put a small slit in the bottom of the sac underneath the heart, and that allows for drainage afterwards. This man is a genius. He's done more of these surgeries than anybody in the world. He was very much so, obviously, behind it. So it was a no-brainer for me. So I did sign up for that. I don't know. It's basically a flip of a coin if they do it or not, because it is a clinical trial. So I still don't know if they actually did that to me, but I'll find out when I go back for my consultation. 1 month, 2 weeks actually. It's like 3 weeks out from now. So anyway, they asked me if I could walk into the operating room. I said absolutely. I'd love to walk in. Doors opened up. Very intimidating. There was about 5 or 6 people in me. The 2 anesthesiologists walked in with me. There was about 5 other people in there, and they had masks and shields on. They were looking, they were looking down. They were, heard tools being moved, and basically, I just wanted to. At that point, I wanted to just get on with it. Vividly remember all of it right now. I got on a very, very narrow table. I remember because I was my shoulder blades were definitely hanging off, but it was narrow. My head got put into like a head holder. They tied my legs down and they put an IV in and basically said, all right, we're going to give you some relaxation medicine again. And that was it. I was out and don't remember anything else. The next part is probably one of the worst parts. First and foremost, that was about noonish at that point. At about 6 o'clock, I was in ICU. I don't remember this part, but the ICU nurse began to take me off the anesthesia. I began to come out a little too quickly. My wife was, of course, right by my bedside. And it was pretty awful for her because apparently I began to get very restless, and thank God my arms were tied down, and I was struggling. I wanted it out. I had, like I said, 3 IVs on this side, 2 on this side. I had 3 in the neck, 2 drain tubes, 4 wires, and various sticky things all over my chest, and of course a catheter. But so probably wasn't most comfortable, but the worst part, I'm sorry, I left out the most important factor, is the 2 breathing tubes. And so I came out, I couldn't speak, I was restless, I was going crazy. My wife was trying to calm me down. So what they did is they actually gave me some more anesthesia and put me back under, and basically brought me out slower a few hours later. This is where I do have my first memory. I remember, again, waking up now. It was closer to 9:30-ish, I guess, at this point, 10 o'clock. Again, my wife, my amazing wife, still by my side. And I began to come out. I had the breathing tube in. I could not speak. I remember looking up at her and just begging her to please take it out, take the breathing tube out. But they couldn't at that point. They had to get a certain reading from the blood. I think it was a protein reading, not 100% sure, but they needed to see a reading and also get confirmation that I was able to breathe on my own and my lungs were fully functional. So that was like another 45 minutes. I was in and out. I don't remember 100% of it, but I do remember it not being a very pleasant time. I remember looking up at my wife, like I said, just basically begging her to pull it out and get the nurse to pull it out, and it was another emotional time. But again, it went by quickly. They were able to pull it out, and at that point, I guess it was close to 10:30-ish. The thing I remember most about that point is not being able to move. As the anesthesia slowly wore off, I do remember at this point an extreme amount of pain. Again, just hours prior, my chest was sawed open. My total body cavity was spread open. So understandable that there's going to be a lot of pain. I was okay with it. It was intense. I handled pain pretty well. But it was like a 3-hour window until they were able to transition it over to a drip, Dilaudid, and that was hooked directly into my neck and was pretty instant. So once that was about 1 o'clock-ish, Once that was under control, 1:30, 2 o'clock, whatever it was, that then the pain, everything kind of mellowed out. I was handed a basically a button. I was able to push it every 10 minutes. If you push it in the middle, it wouldn't do anything. 10 minutes goes by, you press it, it beeps. It gives you a very small dose, but it goes right in through your neck, right in through your system, and it's basically instant. So I would say I pressed it on average 3 times an hour. I guess I'm a glutton for punishment. I wanted to feel it a little bit. I didn't want it to. Now, definitely a fine line here because everybody is obviously very concerned about pain medicine. And I'll get to that later on also. But basically, the nurse described it to me as this. First of all, I don't take painkillers. I barely take aspirin. I don't really take anything, which was also a very key factor in the surgery. But yeah, I'm not much of a medicine guy, but she did explain it to me this way because I was hesitant to take it. Basically, you can't get addicted to pain medicine if you actually have pain. Because if you have pain, which I did, the pain medicine essentially goes to where you're having the pain and takes it away. Now, if you take pain medicine without any pain, that's where you run into problems. That's a whole separate story. So I won't talk about that. But and also a very important factor is your body has been through hell. Probably nothing that your body's ever gone through. I mean, it was basically, like I said, your chest is ripped open, your insides are fondled and touched and moved around, and heart is stopped, and it's pretty. You have breathing tubes going under your lungs, under your ribs, under your heart. So basically, your body needs to heal. If you're in excruciating pain, your body will not heal, or it will take a lot longer. So taking the pain medicine, I learned it was a good idea, and it did help. It helped to help my body to relax. But like I said, I was basically every 20 minutes or so I would push it. Once I started to get uncomfortable enough to the point where it was painful, I would push it, beep, instant, and it would go away. So that was a little tricky getting used to that, but I did quickly. ICU was great. It was comfortable. The nurses were amazing, unbelievable. My wife was by me the whole time. She, again, amazing. Then the next day was Friday. Immediate family came, mother, father, brother. Spoke to them. I was in bed, sitting somewhat upright, but still not mobile. Pretty much all day. I had some Jello. I had I think a little bit of a yogurt. But one thing is they do pump your body. They fill your body with about 15 pounds of fluid. So I did notice very quickly that my hands were difficult to move, my feet were difficult to move, my calves were blown up, my legs were blown up, my whole body was pretty much blown up, which is normal what they do for surgery. Which your body's getting rid of that fluid at a rapid rate, which is why the catheter comes into play. So that was very helpful. But in the ICU, like I said, nurses were great. One of their many main focuses is on the drainage tube and looking at the color coming out. Not very pleasant, but part of it. Drain tubes were about a half inch. They were pretty intimidating. One ran underneath the sternum and one right underneath my ribs on my right side. 2 bags and constantly draining into that. But yeah, it was just a very low-key day. They began Friday, not much. It was they didn't begin taking anything out Friday, but the next day, Saturday, they began taking. They took one drain tube out. They took one of my IVs out. They took one of my neck IVs out, which was though that was probably one of the more uncomfortable, not painful, just discomfort, because it was, like I said, you had something coming out, you really couldn't move at all. It wasn't pleasant. But at that point on Saturday, they did tell me that it was I was good enough to leave ICU. Less than 48 hours after surgery, My numbers were great. They wanted to put me in the step down unit. They didn't feel any need for me to be in the ICU anymore. So Saturday early, it was late morning. Late morning, I was up, and they got me up, and I was walking, holding a wheelchair. Actually, I walked the wheelchair uh, around to the other side of the hospital, and we went into a step down unit. There, we got settled. They were able to pull the other two of my neck IVs and got me settled. Everything was very slow. Any kind of movement is painful. You can't move your arms much. I mean, if you know beforehand, I mean, just feel anytime you move anything in your body, your legs, your hip, anything, your neck, everything is centralized in this area. So, I mean, let's face it, they cut your chest muscles, they cut through your nerves, they're cutting through your bone and spreading open your chest. So anything in this area that is all connected. And one thing, important thing I learned is at a young age, 41 years old, the doctors and nurses, they explained it to me that it's good in a lot of ways. One of the drawbacks is when you're younger, you have a lot more pain receptors, and what happens is when they're cutting through all that, it's 10 times more painful than as an older person getting it. But the drawback to an older person is you take a lot longer to heal. As a younger person, you heal much quicker. So I was in a lot more pain, but for a shorter period of time, and I healed a lot quicker. I mean, there was an 80-year-old guy in there. He was in there for 2 weeks. They said, a couple days after the surgery, he was moving around. He didn't really feel anything, but he was in the hospital a lot longer. So only drawback is it is more painful, but it's short lived. So that's Saturday. Saturday night going into that was Saturday. Going into Sunday. Sunday they pulled another drain tube. I didn't explain about the first drain tube, but same thing with the second drain tube. It's not pleasant, but it's not terrible. It was basically lay back flat. That was the hardest part. To pull the drain tubes, you have to lay flat, and that was tough. I mean, I really didn't feel them pulling the drain tube out. You feel it a little bit. It's more of a, it's a good